Welcome to the Frisco Podcast. I'm your host, Scott Ellis, and in this episode, we are having a chat with Dr. Jay Woody, the founder of Legacy ER, and we're going to talk a little bit about Legacy ER and the topic of the day, COVID. So, Dr. Woody, welcome to the Frisco Podcast.
Thank you for having me. Excited to be here today.
Thank you. Good to have you here. Obviously, with everything going on, there's a lot to talk about, particularly around COVID. But before we get into that, I wanted to talk specifically about Legacy ER. That is a business that you started. It's something that I would call a Frisco success story. But why did you start Legacy ER, and how long have you guys been in business now?
So my background is I'm board certified in emergency medicine, worked in the traditional hospital, big hospital ER settings, spent all my formative years down at Parkland Hospital, our level 1 trauma center here in Dallas, and then sort of moved out to some other hospitals that most of you be familiar with in the community. And what I really saw was the patient experience was typically lacking. And there also were a lot of patients that were coming through the emergency department that didn't actually need to be in the ER. They needed acute care, but they didn't need emergency services. And what was happening is those patients that needed acute care, but not necessarily emergency care, they were being penalized financially by the big bills that we all know come out of the emergency department. And so sort of taking my sort of passion of improving the patient experience and also including that billing experience as well, that's really the genesis of where Legacy ER and urgent care, came from. And we opened our doors in August of 2008, back when Frisco was just a tiny little farm town, which for those of you that were here then will remember, it was pretty much a bunch of dirt fields where we opened up our original location on Main and Legacy. And obviously things have changed in the last 12 plus years. And now, of course, we're surrounded by retail there, and we don't have farm fields around us anymore. But it's been very, very exciting. We now have 2 locations in Frisco and a total of 6 locations here in the North Dallas area. We've also been blessed to have a sort of success story that's very Frisco centric. And we now have additional 2 facilities in New Mexico, 3 facilities in Indiana, and 1 facility with another one soon to open in Florida. So really, I live in Frisco, been here for about 16 years. And so this, I believe, is a Frisco success story. And I'm excited to still be here and intimately involved with the business and caring for the people of Frisco.
Well, good. And we're glad to have you here. And thank you for opening those up. I know that early on, when we first started chatting with you, you wrote an article for Lifestyle Frisco about the difference between the different kinds of urgent care facilities. And hopefully I'm broadly classifying those. There's ER, like a Legacy ER, but then there are other types of facilities that are also, I guess, urgent care, but the way they operate and the way they bill are kind of different.
Yeah, so I think we all understand the traditional hospital-based emergency room, and we know how they bill. It's ER billing. Then sort of in 2010, there became this trend of freestanding ERs, which I think, again, a lot of us probably saw the rise and sort of the fall of those. Those facilities were emergency rooms outside of a hospital, but they also only did emergency billing, regardless of what type of care or level of care that you needed. It was emergency billing. So, for example, if you just had a simple strep throat, they could definitely handle that, but it's gonna cost you, at least $1,000+ for that. And so the difference in what our model does is we have urgent care billing for those minor problems, such as strep throat, and we have ER billing for those cases that typically would have to only be cared for in a hospital emergency room. So, for example, people needing CT or CAT scans, sort of advanced labs or imaging. Normally, you have to go to the hospital to get that. But with our model, you can get those levels of service, as well as if you don't need those, then you're not going to pay that emergency bill. You're going to have the lower urgent care billing. So that is what is unique about our model and makes us sets us apart. And obviously that's good for patients because healthcare is super expensive. So you really only want to pay for the care that you need and not for anything more or anything less. It works both ways. And so I think, that's what makes this model very patient centric. We've also found that the payers like it because it saves them money as well. And we've also found that local businesses that are self-funded like it because if their employees go to the ER and they don't need ER services, that business is going to pay a lot for having the level of service that their employees didn't need. So this model is unique and it helps all three of those sort of pillars of the community and healthcare system.
All right, that's good information because I have a feeling the billing side of that and the differences are something most people are just not familiar with and wouldn't know that one's going to be more expensive than the other, even if the treatment's the same in many cases. So knowing that you guys can adjust accordingly is very helpful. Yeah, no, and I think it takes the guesswork out of patients' hands because a lot of times, for example, I'm a parent and so I know how, I wear a parent hat sometimes and I wear a doctor hat sometimes. So most of us that are parents, if our child is injured, say, falls out of a tree or off the monkey bars, we panic a little bit and we say, hey, where do we go? Can we go to the pediatrician? Can we go to the urgent care? Or do we need to go to the ER? And if you're not sure, most of us default to the highest level of care. We say, you know what? It's my kid. I'm going to go to the ER because I know they can take care of it. And that's absolutely true. But if they don't need the ER, then that's where that sort of financial penalty comes back and hurts you. But again, we're asking patients to sort of be medical providers and most of us didn't get that training. And so it's not fair to put people in a position where they have to pick. And if they pick wrongly, then they penalize one way or the other. The converse can be there as well. For example, if you end up going to only urgent care, but you needed that higher level of care, well, then now you've got ambulance involved transporting you to another facility. You've got two co-pays or two times hit your deductible. So again, our model solves for you don't have to know, you don't have to be a medical clinician to figure out, where do I go to the hospital? Do I go to the freestanding ER? Do I go to urgent care? You come to us and we'll make sure that you get taken care of. And we'll also make sure that you only get a bill that's appropriate with the level of service that you needed. In Frisco proper, what locations do you have at Legacy ER?
Yes, we have two locations in Frisco proper. One is at Main Street in Legacy, and the other location is at Custer in El Dorado. Also, we got McKinney, Allen, Coppell, and North Richland Hills. So kind of, cross the whole sort of North Dallas Metroplex area.
That sounds good. Just so that, people in the community know where to go. Okay, next up is we're going to talk a little bit about COVID. This is obviously the topic du jour. There's a lot of information, and I think sometimes very confusing information being spread around the disease itself, around the vaccines that are coming out, so on and so forth. So I wanted to ask you a couple of questions COVID specific. First and foremost, let's talk about the vaccines real quick. What do you know about them? My impression is that these vaccines have been well tested. They are safe, despite the fact that they were brought to us in record time. But what have you been hearing? What do you know about getting vaccinated? And should people be looking forward to getting vaccinated as soon as they're able to do so?
Well, I'll start off with saying that I am very much looking forward to getting vaccinated. I obviously being on the front line, I'm, in the sort of front of the queue, if you will. And I do believe in the vaccine. And I think, that's given me hope sort of as we close out the end of this year. The vaccine is sort of one of the most hopeful things for me and other healthcare providers, for where we're going forward. So that being said, I know there is definitely some apprehension out there because the vaccine was developed so quickly. I get it. As much as I know, I'm not an expert in vaccines. I've done a lot of reading about them. And based on my understanding and based on, people much smarter than me and experts in this area, I feel comfortable with these vaccines and frankly impressed with the effectiveness of them, because I think what most people don't realize, we all know about vaccines. We've been getting them all our life, and most of them are good. Most of them are not great, but they work because everyone gets it. And so we sort of get that herd immunity that people are talking about. These vaccines are, even the ones that aren't the best are actually in the great category, in my opinion. And so I think because there's a couple of manufacturers that are making these vaccines. I think they're safe and they're effective. And I am, like I said, looking forward to getting mine and sort of navigating that right now, because not only is it important for me, it's important for all the healthcare providers, and my employees, because we got to keep them safe so they can continue to sort of help you and the others if you fall ill.
Yeah, absolutely. And I know that you guys definitely are on the front lines of this, and we're very grateful for everything that the healthcare providers have been doing to try to keep us all as safe and healthy and moving forward as possible.
Well, thank you. It has no doubt been a challenging year for, I think, all of us in, Frisco and Texas and essentially the whole world. So, and then especially challenging for those of us in the healthcare field. So again, that's why I'm hopeful that the vaccine has arrived. There's been a lot of talk about it, but now the fact that I personally know colleagues that have received the vaccine, I'm excited, and like I said, looking forward to getting mine and starting that process, since it's a two-shot process.
Yeah, that's right. It's one and then a second a couple months later.
Well, it's one, and then depending on which vaccine it is, it can be 3 weeks to some more after that. But yeah, it is. And I will emphasize too, it is important to get that second round, or else the vaccine isn't as effective as the numbers you might have heard in the media.
Very good. So I without getting too deep into the science that would probably elude most of us anyways, as I understand it, these are mRNA-based vaccines, which are a little different than what we've had in the past. And the technology behind that's kind of fascinating, and how they actually engineered these differently than vaccines that we've had in the past. So do you think that plays into the efficacy, though, of them? Is that part of why?
I think so, because these are fascinating vaccine. The technology behind it is very fascinating. And so essentially in the old days, they would take, a virus or something, and they would weaken it and expose a person to it. And so your body kind of attacked it and built up antibodies to it. Sometimes they would take pieces of the protein of a virus or whatever it is you're vaccinating again and give that to a person so that your body could, again, build up an immune response to this. The way this vaccine, I won't get too technical, but in a nutshell, it's basically put in these little mini lipid droplets, which is why the sort of temperature control is so important, because this lipid is unstable. And the mRNA is put into your body, and your cell incorporates that mRNA and actually starts sort of making its own making the products that helps your body mount an attack. So it's very different technology. And I think that is why the efficacy of it is so great, because your own body's immune system is doing the work to make this happen.
Interesting. Let's talk about testing. Some people have gone out and gotten tested. Other folks have not been tested. Once you've been tested, if you get a positive result, there's typically some kind of quarantining protocol that goes along with that. And then it may be even different whether you've been potentially exposed to something or you've got full-blown COVID. And to be honest, I'm not even clear on, if that happened to me, what is the quarantining protocol? What am I supposed to do? How do I know when it's safe for me to be around other people again? Can you maybe clarify that for us a little bit, just so that as people are potentially in situations where they might be exposed to somebody, or they find out later somebody they were around was exposed or had COVID, and they have some idea of what they're looking at doing or how they're going to handle it? Yeah,
it has been very confusing, and there's been constant changing on that. So I will appreciate the opportunity to kind of help direct people so that we can all sort of work together to help each other and get us out of this pandemic. So I'll start with the person who is positive, because that one's sort of the easiest, if you will. So if you test positive, the current CDC recommendations are that based on the day that the symptoms started, not necessarily when you took the test, but the day the symptoms started, that's day one. And you basically need to march out 10 days post the day that your symptoms started. And then on that sort of last day, if you are fever free without taking, Motrin or Tylenol or anything like that, and this is fever free, and you have improving symptoms, you are out of quarantine. There's confusion on when do I start counting my days, and it's not the day you tested positive. It's because typically what happens is a guy starts to feel bad, and then all of us are in denial. And we're like, oh, I'm sure it's nothing. And then the next day, our significant other says, hey, you really need to go to the doctor. And so you go in, they test you, you're positive. But that's like you're on day 2 now because your symptoms started that day. It's not from the day of testing. And then again, you got to march out those 10 days. And then assuming no fever and assuming improving symptoms, not no symptoms, but improving symptoms, then you are free to roam about the city.
We don't want to encourage too much of that, but I understand the point.
Right. With your mask, of course.
With your mask, of course.
Yeah.
Okay, so that's the situation for I've got symptoms, I've tested positive.
That's right. So let's take the scenario. You live in a household where somebody tests positive. And so now you're saying, what do I and the rest of my household need to do? Well, one is I would even quarantine that person in the home themselves. And I would also have them wear a mask if they come out into sort of any common areas, just sort of to help prevent the spread to the others. But the other people in that household, or if it's at work or wherever it is you got exposed, there are 2 pathways that the CDC has come out with. They both require that you have 0 symptoms during the monitoring period, but the 2 pathways are, one is, again, the date of exposure is day 1. You march out 7 days. And if you've had 0 symptoms within those 7 days, you can get a test done. And if that test is negative, you're out of quarantine. The other pathway is, again, start at day 1 of exposure. You march out 10 days with no symptoms. And at the end of the 10 days, you're out of quarantine.
Gotcha. Okay. That's very clear. I think that makes total sense. So hopefully everybody will be able to follow along with that easily enough, and gives them some idea of what to do if they have been exposed to someone but don't have symptoms, or if they've actually tested positive and now they know what, kind of what they're in for.
That's right. And just to clarify, this is a change from what the quarantining recommendations used to be. It used to be 14 days post-exposure. So again, if some of your listeners are thinking, wait, I thought it was 14 days. It used to be there was only one pathway, and it was 14 days. If you have no symptoms, you're out of quarantine. CDC revised those in order to try to encourage compliance. There is a slight increase of risk of missing a few people with the 2 pathways I described, but those are the currently accepted recommendations. And it also, the hope is that it will increase compliance, because what was happening is I think not everybody was staying that full 14 days. And obviously then we were getting some people that were positive that were out in the community kind of spreading it around. So I too hope that the sort of shorter period will help everyone, try to be as diligent as possible and stay compliant.
So that leads me to another question, and that is about individuals who may have contracted or have contracted COVID but are asymptomatic. We've all heard a lot about asymptomatic spreaders, and I think that confuses a lot of people as well. So I'm hoping you can maybe enlighten us a little bit to if somebody gets tested for whatever reason, has a positive result from that test, but never shows any symptoms, there's still the risk that people who have been exposed to them in that time frame may come down with COVID, correct?
That is correct. And going back to what does that patient that you described, where does their time frame start? Since if they truly had 0 symptoms, then you use the day of testing positive as day 1. But you're right. We don't really know when they were contagious, how many days prior to the testing. And so that's where, contact tracing is ideal. I know there's not a lot of that, going on, but that is something maybe people have heard about, contact tracing, but that would be where, anyone that the person that turned positive or anyone that they sort of have been around, not socially distanced, and, over the certain period of time prior, you could notify them so that one, they could either, be tested or follow the, exposure quarantine recommendations. It's very complicated. And I think that's one of the challenges why compliance has been difficult, because one is, not clear messaging. Two, the messaging is very confusing. And three, it has changed over time and morphed. And so, again, I get it and I understand it, and I sort of live it every single day. And I still have to, I still am challenged to keep up with what's, the right thing to do.
Yeah, understood. But I really appreciate the clarification on all of those fronts. And hopefully anybody that's listening to this here in Frisco it'll make sense to them, but we'll also have it written up on the page that this episode will be on the website. So hopefully this will give people a little bit more clarity around what to expect. And then last but not least, if someone wants to get tested for whatever reason, can they come to Legacy ER for that?
Absolutely. So this is sort of a good segue, if it's okay, kind of talk about the testing and the different types of testing. So there are a number of categories of testing. There's something called antigen testing. This is testing for active disease, and it's that type of test is looking at some of the parts of the virus itself. Now, there's another type of testing called PCR testing, and that actually is looking for the mRNA or the RNA that's actually within the virus. There's some discussion about which test is better than the other. From all the data that I've looked at, they are very similar, but the PCR test is considered the gold standard. The problem with the PCR testing is currently most of that has to go to a reference lab, and it's taking from 3 to 10 days to get those results back. And so you're a little bit at a disadvantage because of the time frame, even though it is potentially a slightly better test. There is more access to rapid antigen testing. And the benefit of that is in 15 minutes, you have a result from that test. Now, if that test is negative, there's some caveats to that. If the test is positive, then it's positive and you need to do the things that we just talked about. At Legacy ER, we have access to both the rapid antigen testing and we also have access to the PCR testing. So you can get either one of those tests. Again, both testing for active disease. There's also you might have heard of something called antibody testing. And that's actually looking for antibodies within your body that would show that you had been exposed to COVID-19 previously, not currently, but previously. And it's looking for something called IgG. It's an immunoglobulin, and that typically shows up about 3 to 4 weeks post-infection. So for example, if you were sick with COVID right now and I checked for your antibody, yours would most likely be negative.
Okay, interesting. So how, I guess, practical for most people is that test? It seems like the PCR or the other one would be better to find out if I'm actually got it, like sick.
Yes, absolutely. You're right. The antigen testing or the PCR testing are obviously those help us determine, quarantining, exposures, all those things. The antibody testing is probably a little bit more of a novelty. I was sick 3 months ago, really bad, high fever, cough. What was it, COVID? I would like to know, do I have antibodies to COVID or do I not? So I think it is helpful in some ways as far as that's regarding, but it's not helpful sort of acutely right now because, we really right now we're dealing with active cases and active disease, and the rapid antigen test or the PCR test that's what we need access to today to help direct people and guide them. What do they need to do to protect their friends and family?
Okay, that makes sense. So before we knock off here, is there anything else regarding COVID or legacy ER that you would like to leave us with before we?
Yes, a couple of things. One is just to reaffirm, we have, legacy ER, we do the rapid antigen testing. We can do the PCR testing. We can also do the antibody testing. So those are all available to those who need it. And, the other thing is we've gone to great lengths to protect our patients who come through. And I think that's something particular in the beginning. People were not accessing healthcare and they were winding up getting into trouble, having complications with appendicitis or not seeking, help for injured extremities and things like that because everyone was so afraid of COVID. But what I can reassure everyone is that, we have all the proper PPE equipment. We've actually invested in some pretty cool technology that has ionizing radiation to sort of clean our rooms, make sure, all the countertops and surfaces are COVID free. And so I think just to sort of put people's minds at ease, if you come in, we're going to keep you safe and we're keeping our employees safe so that they can continue to take care of you.
Good. Well, thanks again to you and all of your staff for being there for us when we need you, whether it's COVID or something else. We appreciate you guys hanging in there.
Absolutely. And I am appreciative of all the people in the Frisco community who've been very supportive of us. We've had lots of nice notes and treats and well wishes from everyone. And so during this time when sometimes it seems overwhelming, the number of patients coming through, the bombardment with COVID-19 and it continuing to rise despite our best efforts, it's the support from the community has really helped us. So thank you, City of Frisco for what you've done for us.
Very good. And last but not least, if people want to find out more about Legacy ER, where can they go?
I think the best place these days is online. You can just Google Legacy ER urgent care, and it shows all our locations. There is a specific area that talks about COVID-19 informational plus the testing details. There's also a pretty cool FAQ section about COVID-19 and testing. So I think that would be a great resource to go to our website to learn more about COVID and testing and sort of what Legacy ER and urgent care offers in that regards.
Okay. And if they want to go straight there, what is the website URL?
It is www.legacyER.com.
All right. There you go. We'll make sure to link that up in the show notes, along with the transcript of everything we've talked about here today. So I want to thank you again, Dr. Jay Woody, for joining us on the Frisco podcast.
I appreciate your time, and thanks for letting me offer some information today.
And thank you to all of you who are tuning into the Frisco podcast. We appreciate you listening in, and we'll talk to you next time.